Every single day in the United States, thousands of seniors collapse suddenly. They're at the grocery store, in the kitchen, even sitting quietly with family, and in an instant, they lose control of their body. The most terrifying part? Many never see it coming. No chest pain, no long warning, just a sudden fall, confusion, or silence. For many, this hidden danger is stroke, a brain attack that can strike without warning, leaving behind lasting disability or even taking life in minutes. And yet, too often, the earliest signs are brushed aside as just aging or just feeling tired. Here at Wellness for Seniors, we believe knowledge is the most powerful protection. In today's video, we'll uncover the silent warning signs of stroke, why thousands of seniors collapse without knowing why, and, most importantly, what you can do right now to protect yourself and your loved ones. So stay with me, because the information in the next few minutes could truly save a life. Warning sign number 1, sudden vision changes. One of the most overlooked and most dangerous early warnings of a stroke is a sudden change in vision. It doesn't always feel dramatic. Sometimes it lasts only a minute or two, and then everything seems back to normal. That's exactly why so many seniors brush it off, telling themselves, maybe I was just tired. Maybe I need new glasses. But the truth is, these brief episodes can be the brain's desperate cry for help. Here's what happens. A stroke occurs when blood flow to the brain is blocked or disrupted. When that blockage affects the part of your brain responsible for sight, even for a few seconds, your vision can suddenly dim, blur, or disappear in one eye. Doctors call this amaurosis fugax, sometimes described as a curtain coming down over your vision. Imagine sitting at the breakfast table. One moment you're reading the paper. The next, your right eye goes cloudy, or you see dark patches, like someone pulled the shades down. A few minutes later, it clears up. You feel relieved, but you shouldn't. That short-lived episode could mean a blood clot has already passed through your artery, and another, larger one could be coming. Mary, age 68, thought she was fine after her vision blurred while she was knitting. She blamed it on eye strain. 2 weeks later, she suffered a major stroke that left her unable to move her left arm. Doctors told her the earlier vision problem was a clear warning, one that, if taken seriously, could have led her to treatment before the big event. Studies show that seniors who experience sudden vision loss, even briefly, have a much higher risk of stroke within the following days and weeks. That's why it's critical to treat these episodes as an emergency, not an inconvenience. The American Stroke Association says, if you notice sudden blindness, blurriness, or loss of vision in one or both eyes, even if it lasts only seconds, call 911 immediately. Don't wait to see if it goes away. Every minute counts, because each one could mean more brain cells lost. It's important to understand, aging does not cause vision to vanish suddenly. Needing reading glasses or having cataracts is different from instant vision changes. When your eyesight cuts out like a light switch, even for a moment, that's your brain waving a red flag. So if you ever think, that was strange, but I feel okay now, remember Mary's story. A temporary curtain over your eyes is never just normal aging. It's your body whispering, pay attention before it screams. Backhand index pointing right and vision problems are just the beginning. Another silent stroke warning often appears not in your eyes, but in your face, sometimes as subtle as a crooked smile. Let's look at the next sign you should never ignore. Warning sign number 2, sudden numbness or weakness in the face. The second silent warning sign of a stroke can be so subtle, many seniors, and even their families, miss it. It's sudden numbness or weakness in the face. Picture this. You're smiling for a photo at a family gathering. Everyone is grinning, but someone notices your smile looks uneven. One side of your mouth droops just slightly. Or maybe, while brushing your teeth, you realize you can't quite keep the toothpaste in your mouth. These might feel like small, almost silly moments. But to doctors, they are flashing red lights. Here's why. A stroke blocks blood flow to areas of the brain that control movement and sensation. When that happens, the muscles in your face can weaken instantly, often on one side. You might feel tingling, numbness, or notice that your eyelid or cheek seems to sag. Some describe it as their face feeling heavy or not quite right. And it's not just your reflection in the mirror. Sometimes family or friends spot it first. That's why healthcare experts encourage everyone to remember the acronym FAST. F. Face drooping. Ask the person to smile. Does one side droop? Arm weakness. Ask them to raise both arms. Does one drift down? S. Speech difficulty. Is their speech slurred or strange? T. Time to call 911. If you see any of these signs, even briefly, it's an emergency. Take the story of John, age 72. He was out walking his dog when a neighbor noticed his smile looked crooked as they chatted. John laughed it off, thinking it was just fatigue. The next day, he collapsed from a major stroke. Doctors later said that if he had gone to the hospital after that first droop, they could have given him treatment to prevent the damage. This is the heartbreaking truth. Strokes often give us these early signals, but too many people dismiss them as just tiredness or old age. In reality, the brain is calling for help. The American Stroke Association emphasizes that even temporary facial weakness should never be ignored. Sometimes these episodes last only a few minutes, called mini-strokes or transient ischemic attacks, TIAs. But each TIA is like a rehearsal for a larger, more devastating stroke. So the next time you catch yourself in the mirror and think, "My smile looks a little off today," don't shrug it off. If it comes on suddenly, it's not vanity, it's a warning. Act fast, and you might prevent a life-changing event. Backhand index pointing right, but stroke doesn't only steal your smile. Sometimes it steals your words. The next warning sign can be just as frightening and just as easy to dismiss. Let's talk about sudden speech changes. Warning sign number 3, sudden trouble speaking or understanding words. One of the most terrifying stroke warnings isn't something you see in the mirror, it's something you hear in your own voice. It's when, suddenly, your speech changes. For some, the words come out slurred, like after a dental procedure. For others, they can't find the right words at all, sentences stop mid-thought, or the wrong words tumble out. Sometimes the person speaks clearly, but they can't understand what others are saying. Imagine sitting at the breakfast table, wanting to ask your spouse to pass the milk, but instead the words come out jumbled, or nothing comes out at all. You know exactly what you want to say, but your brain and mouth aren't working together. That disconnect is a hallmark of stroke. Here's why it happens. The brain has specialized areas that control language and comprehension. When blood flow to these regions is interrupted, even briefly, your ability to speak or understand speech falters. Doctors call this aphasia. It can strike suddenly and, like vision loss or facial droop, it may last only a few minutes before things feel normal again. But normal isn't safe. It's a warning that a bigger stroke could be coming. Let's look at Susan's story. At 66, she was chatting with her daughter on the phone when her words started to sound slurred. Her daughter thought the connection was bad, but within moments, Susan couldn't form words at all. She hung up, embarrassed. A week later, she had a severe stroke that robbed her of speech for months. Doctors later said her phone call was the early warning, a mini-stroke that could have been the chance to get life-saving care. The American Stroke Association stresses that any sudden change in speech should be treated as an emergency. If your words sound wrong to you, or if someone tells you your speech sounds strange, don't wait and see if it improves. Call 911 immediately. And this doesn't just apply to speaking. Trouble understanding words is equally dangerous. If you suddenly can't follow a simple conversation, can't read the morning paper, or can't process instructions, that confusion may be a stroke at work. Here's the key. Age alone does not cause sudden slurred speech or language problems. Feeling tired might make you mumble, but it won't make your words vanish mid-sentence. Only a disruption in blood flow to the brain can do that. So remember this, if you or a loved one experiences sudden speech difficulty, even for a few seconds, treat it like the fire alarm it is. The brain is telling you, act now. Backhand index pointing right, and speech isn't the only thing a stroke can steal in an instant. Sometimes, the warning comes in the form of pain, a severe, sudden headache that feels different from anything you've had before. Let's explore this next crucial sign. Warning sign number 4, sudden, severe headache. Most headaches are harmless, caused by stress, dehydration, or maybe a poor night's sleep. But there's one type of headache you should never ignore, a sudden, severe headache that feels different from anything you've had before. Doctors often describe it as the thunderclap headache. It strikes suddenly, like a bolt of lightning, and the pain is intense, often described by patients as the worst headache of my life. Unlike a tension headache that builds slowly, or a migraine that you've learned to recognize. This pain comes on out of nowhere, reaching maximum intensity in seconds. Here's why this is so serious. A sudden severe headache can be caused by bleeding in the brain, a type of stroke known as a hemorrhagic stroke. When a blood vessel bursts, pressure builds rapidly, and the pain is the brain's alarm system screaming for help. Take the case of Robert, age 70. He was watching TV one evening when he suddenly felt an explosion of pain at the back of his head. He thought it might just be stress, so he lay down. Within minutes, he collapsed. Robert had suffered a massive hemorrhagic stroke. Doctors said if he had called 911 at the first moment of that pain, his outcome might have been very different. The American Stroke Association and neurologists worldwide agree. Sudden, severe headaches in older adults should always be treated as medical emergencies, especially if the headache comes with other symptoms like nausea, vomiting, confusion, vision problems, or weakness. It could signal a brain bleed or major stroke in progress. And here's something many seniors don't realize. Even if you've had headaches before, if this one feels different, sharper, faster, heavier, you can't afford to wait and see. By the time relief comes, brain damage may already be happening. Remember this rule of thumb. If the pain makes you stop what you're doing instantly, it's not an ordinary headache. Call 911 without delay. Because when it comes to stroke, every minute matters. Treatments are most effective in the first hours, sometimes the first 60 minutes, after symptoms begin. Ignoring that thunderclap could cost more than just comfort. It could cost independence, mobility, or life itself. So the next time you feel a sudden, severe headache that doesn't fit your usual pattern, don't shrug it off. Trust your instincts and act fast. Backhand index pointing right, but stroke doesn't always announce itself with pain. Sometimes it creeps in more quietly, stealing your balance and coordination. The next warning sign can look like a simple stumble, but it may be much more serious. Warning sign number 5, sudden dizziness or loss of balance. Not every stroke strikes with obvious pain or paralysis. Sometimes, the warning shows up in a way many seniors dismiss as just getting older. It's a sudden spell of dizziness, a stumble, or feeling like the room is spinning out of control. We've all felt lightheaded at some point, maybe when standing up too fast. But stroke-related dizziness is different. It can strike suddenly, even when you're sitting down, and it often comes with trouble walking straight, loss of coordination, or a feeling that your body won't obey your commands. Here's why. When a stroke disrupts blood flow to the cerebellum, the part of your brain that controls balance, the signals between your brain and your muscles get scrambled. The result can be staggering, veering to one side, or even collapsing to the floor. Seniors sometimes describe it as, "My legs just gave out," or "the ground moved under me." Take Barbara, age 74. She was gardening when she suddenly felt dizzy, like she had stepped onto a moving boat. She tried to steady herself, but her right leg dragged, and she fell. Luckily, a neighbor saw her and called 911. Doctors confirmed it was a cerebellar stroke. Because she got help quickly, Barbara avoided permanent disability. The tragedy is that many seniors don't take this sign seriously. They assume dizziness is just part of aging, dehydration, or a side effect of medication. But when dizziness strikes suddenly, especially if it comes with nausea, double vision, or weakness, it's often the brain sounding the alarm. Neurologists emphasize that strokes in the back of the brain are some of the most dangerous, and they're also the most frequently missed. Patients are often sent home with a diagnosis of vertigo or inner ear problems until a larger stroke occurs. Here's the golden rule. If you suddenly lose your balance, stumble, or feel a spinning sensation out of nowhere, treat it as a medical emergency. Don't wait to see if it improves. Don't chalk it up to age. Call 911 immediately. Because while a stumble may seem harmless, it can be the body's way of warning. Your brain isn't getting the blood it needs. Backhand index pointing right now that we've uncovered 5 hidden warning signs. Let's step back and see the bigger picture. What do they all mean together? And most importantly, what can you do starting today to protect yourself from becoming one of the thousands who collapse without knowing why? So let's bring it all together. We've uncovered 5 warning signs that too many seniors ignore until it's too late. Sudden vision changes, when the world goes blurry, cloudy, or dark in an instant. Facial numbness or weakness, a crooked smile, a heavy cheek, a drooping eyelid. sudden speech problems, slurred words, jumbled sentences, or confusion in conversation. A sudden, severe headache, sharp and explosive, unlike anything you've ever felt. Dizziness or loss of balance, stumbling, spinning, or collapsing without reason. Each of these may seem small in the moment. Each might disappear within minutes. But together, they are the body's emergency signals, whispers that can quickly become screams. Here's the truth: a stroke doesn't just happen. It builds, it warns, it tries to tell you. The tragedy is that thousands collapse each day because those whispers were ignored. But here's the hope: if you act fast, if you treat every one of these signs as urgent, you can change the story. You can protect your independence, your mobility, and your life. Think of your brain as the command center of everything you love: walking in the park, laughing with family, remembering special moments. A stroke threatens all of that, but knowledge, attention, and quick action can save it. So remember, your body whispers before it screams. Listen to the whispers. Backhand index pointing right in a moment. I'll share how you can take the next step to stay protected and connected with this community. Knowledge saves lives. If you're ready to take control of your health after 60, hit the like button, subscribe, and share this video with someone you care about.